of the International Society for Telemedicine and Health monthly webinar. My name is Dr. Adeolu Arogunade, and I am the president for the Society for Telemedicine and Health in Nigeria. And I'll be hosting you this afternoon, this morning, this evening, whatever time it is, wherever you're connecting with us from. I warmly welcome you, and it's a pleasure to have you around. Today, we'll be discussing about a very important topic to us in Nigeria, breaking silos, creating a connected health system in Nigeria. Uh, the Society for Telemedicine and Health in Nigeria was founded 21 years ago, April 2005 to be precise. And since then, we have advocated for the deployment of technology in addressing various issues that arise from meeting the health objectives of our nation, Nigeria. And just like it is around the world, we have seen a lot of progress from when we started out and up till now. We are not deterred by the challenges that we have faced, and will continue to push for better healthcare delivery using technology. Hosting us again along with me today, we have the president of the International Society for Telemedicine and Health, and the person of Dr. Michelle Griffith. She's a physician, a telemedicine leader, a digital health advocate, with over 30 years experience in internal medicine and virtual care. Dr. Michelle serves as the first female president of the International Society for Telemedicine and Health, and is widely recognized for advancing telehealth globally. She was educated at Yale, Columbia, and Harvard with Harvard-affiliated programs. She lectures internationally and consults on digital health, telemedicine, and equitable access to healthcare. Please warmly welcome with me today, Dr. Griffith, to give an opening address. Thank you.
Yes, thank you. Thank you so much. I'd like to thank, first of all, Dr. Aragandadi for coordinating and organizing this particular webinar. It happens to be part of our actually first annual series where our national members are sharing progress in their particular region. So please tune in monthly. You will learn what's going on in all different parts of the world and how we as a society are advancing digital health transformation with the goal of universal health coverage and improving health outcomes and access for all. To tell you a little bit, just to share with you a little bit about the society, I'm just going to share my screen. If you are not familiar, let me just put this here. Yes. So the International Society for Telemedicine and eHealth is a global nonprofit network advancing the adoption of telehealth, digital health, and virtual care. With members in over 100 countries, we connect healthcare professionals, researchers, innovators, and institutions to foster knowledge exchange and collaboration. We are recognized as a non-state actor in official relations with the World Health Organization. Our focus areas are global knowledge sharing, interdisciplinary collaboration, digital health education, accreditation and standards, policy, compliance, regulation, and cross-border telehealth, capacity building, and digital health equity. We achieve these goals by a number of different initiatives, including working groups on specialized topics, webinars, podcasts, and international conferences and partner events, education programs, which include digital health courses, ISFTEH endorsed programs and training. We have an annual student research contest and awards, so we are tapping into our future leaders. ISFTEH also has supports the World Health Organization Global Digital Health Strategy, including its research initiatives, and we are an integral part of the global telemedicine community of practice. We partner with Telehealth and Medicine Journal so that our members can publish their works. Our members also collaborate on white papers, research articles. Our membership actually spans 6 different categories: national, corporate, institutional, individual, nursing, and students. And by the way, nursing and student memberships are free. We are able to drive digital health adoption primarily through our strong partnerships. We collaborate with key stakeholders, we accelerate progress and ensure best practices reach those most in need. We are very intentional about bridging the digital divide and ensuring equitable access. So we prioritize telemedicine for underserved populations. If you have any interest, we welcome you to join the Digital Health Network. This is our information. You can learn more about the Society by going to our website. I will say that I am very much looking forward to this particular webinar as I see the progression from silos globally and what we would call an affliction of pilotitis to the progression of integrating digital health into health systems globally. So thank you. Thank you for the time.
Thank you, Dr. Griffith. So next, I'll be calling on one of our keynote speaker. He's a digital health strategist and technologist with over 20 years of experience advancing health information systems and innovation ecosystem. He leads the Digital Health Interoperability Network and has contributed to national digital health strategies, interoperability frameworks, and large-scale health information systems across Africa. He's also the co-founder of Future Fit Innovation Lab, where he drives capacity building in emerging technologies. Please welcome with me our keynote speaker, Dr. Emeka Chukwu. You have the floor, sir.
Thank you very much, Dr. Arogundade and colleagues at Society and all the esteemed guests here that have joined us this morning, afternoon, evening. And I hope you can hear me okay.
Yes, we can.
Okay, yeah. Excellent. Just give me a second to share my screen. And excellent. So thank you again for making time today. Today we'll be discussing breaking silos, creating connected health systems in Nigeria. And this is one of the most talked about topic in global health, digital health in general, how to make sure that things connect. So not much to talk about me. I've been introduced. I will start by looking at the promise that telemedicine promise. So how close is Nigeria to truly a connected digital ecosystem that can support telemedicine at scale? We know that telemedicine traditionally is not supposed to just be video consultation with a patient. But what we see in practice is that telemedicine does not fulfill all of the value, all of the value that we could derive from telemedicine in general. So as a result, many people speculate, different groups speculate different things. Some think, oh, it's governance. Others think it's infrastructure. That's the reason why the EMR systems are not connected, or the telemedicine system are siloed and standalone system. And even when they do integrate, there are challenges here and there. Today, we're just going to talk about the different enabling environments and where they are at in terms of what we've seen in the field, but also how we could move to bridge some of these challenges. We will see that we need a lot of those enabling environments component to be in place. But again, Nigeria has made significant progress, and we may not have seen them because we've not started reaping the benefits. But I'm going to share some of those progress that we've made, despite some of the work that we do within telemedicine or in point of care systems still being really either institutionally or technically or programmatically siloed. So, of course, everything is all about health. So yes, these statistics you may already are familiar that the care quality is not so good, not just in Nigeria, in a lot of places. One of the greatest proposition for telehealth is to bridge the brain drain of our physician and even nurses who go abroad to get paid well. So as a result, they leave us with unsupported care. So yes, you see that statistics there. We have 1 to 5,000 ratio, but WHO is recommending 1 to 600. It means automatically the health workers who are here are overstretched, and then the resulting effect is poor quality service, and of course, preventable deaths as the case may be. But again, we also know that even our infrastructure, despite the human resource challenge of having adequate health workforce, in fact, the problem of rural-urban divide is also there, but also the infrastructure to be able to provide care to people are not there. So before we even talk about the digital infrastructure to support this, most of our facilities still use paper. So when you are doing telemedicine, you are forced to just do video consultation and nothing more. So you re-enter all the patient history. You may not even go back to the facility. And these are things that will continue to be a challenge until we are able to integrate. But there are also challenges, maybe funding needs, reasons why we've not been able to bridge some of this gap that we see in the health system. So in terms of we are at, Nigeria has a lot of policy and legal bedrock for which telemedicine is supposed to thrive. For instance, we have the National Health Law that was passed since 2014 with clear requirements for having certificate of standard. We have National Standards Organization of Nigeria that lays out, adopts standards and make or create new ones where they don't exist. We have the IT agencies and a few others. Even in the health sector, the policymakers are doing their best to move these regulations into policy and that can be implemented at the point of deploying this digital system. But still, we know that there are challenges. We are not where we are supposed to be, but this is just to highlight that we are making progress. In fact, we do have a running plan now with clear detailed approach and roadmap for how to drive integrated system, both at the insurance level, at the EMR level. And Nigeria is actually a very big country that one single system may not cut it. And again, the government has recognized that in their plan by identifying that there may be 3 different exchange systems at a level. I personally believe that we do need just more than 3. But again, it's until we move forward with these projects that we'll start to realize some of the complexities that arise. But this is a very commendable plan, I must say. So that's where we are in terms of strategy. But many of you probably may be thinking or expecting me to share the different components that these enablers that we do need to strengthen and talk to each of them. So we know, starting from workforce, the health workforce is low. We do not have enough of it, but we do not even have the digital workforce. We have limited digital health workforce. Even our digital workforce are migrating. So our developers and system support people, they are migrating and for better pay. So how do we even, in fact, the pre-service and in-service training for health workforce, for digital health in general, it's largely not there yet because we do need some more work to be done. We do have leadership because governance of the leadership for digital health has been defined. We clearly know where that sits. But again, governance, who defines what are the roles of when you want to share information, what are the different things that needs to be shared, that governance and accountability, it's still not there. We do know who the leadership are, what it works, what needs to happen, but there is a little more work that we are still waiting on them to make happen. And again, we used to mistake this by merging this leadership and governance together over the years. But this, over time, we've now realized that just launching the governance structure is not the same as the thing being effective, because we have launched many governance structures in Nigeria for digital health in the past. And so sometimes after launch, we want to put pressure on government to make sure that they govern. It's not just, so we have the legal and regulatory safeguards. Of course, the compliance and enforcement is a challenge. We have infrastructure. We have registries, digital public infrastructures that has been deployed. We have the health workforce registry, the health facility registry. They are there at the federal ministry. But how many people are using them? Because it's not just having them, it's more of using. So while the metrics we've used in the past has been to measure when we have launched a new digital public infrastructure. But again, within the community, we are beginning to ask questions, because I know as far back as 2014, Nigeria has had a health workforce registry, a health facility registry deployed and populated from many states. But today, the question that I and many of my colleagues ask is, how many people are using these registries? It's not just about having it deployed. And again, it's the question that I want all of us here listening in your various countries to ask about this digital public good and infrastructure. Of course, the elephant in the room is the standards. There are standards, global standards, there are local standards. Nigeria has adopted FHIR as the main standard framework for integrating the enterprise in healthcare. But adopting these standards is different from using it. And again, I commend the ministry again for the progress they are making in even making sure that these standards get to be used. We've never seen as much progress in the Ministry of Health as we have seen in recent time. And I think it's something that is worth commending. We know health is obviously very difficult. Then we look at the services and application, of course, which is where telemedicine fall, and which is also where other EMR systems that are supposed to integrate with telemedicine in the facilities where they are deployed for. The challenge that we have is that many of these systems are not mature, or they are various levels of maturity. Either they were deployed to solve financial leakage problem, and again after that the request now came to turn it into a full-fledged clinical system. So the system is constantly being reviewed. And because of that, you go to facility and see telemedicine system separate, the EMR system separate, and the information is entered into one or the other, and they are not connected. Of course, we are not reaping the benefit we expect. Now, for investment, we do have good strategy. I've pointed out already, we do have the strategy, both the health strategy and the digital health strategy. But the challenge has always been implementing this strategy. This is like the third strategy. The National Digital Health Architecture is the third in a series from 2014 to now. This is the third. But we have seen a pattern. It has not been implemented for many reasons. Of course, no pointing fingers, but this is always at the government's table. Government is not putting enough money. The donors are not also aligning around those strategies. But it seems like things are changing now, because we are expecting more and more investment. But again, going back to investment in telemedicine specifically, the private sector seem to be doing a lot of that. And of course, the donors. So in terms of standards and interoperability, I've already talked about this. There are the steps to a connected system where you have the strategy, you have standards, then you develop implementation guides, and then you test out with the community whether this is working. And this is something that we're also working on. The organization that I lead, THIN, is very passionate about driving connected system. And I guess that's also one of the reasons why the president asked me to talk about this, about what we are doing in Nigeria. So DHIN is one of the first, is the first, is the organization that led the first connectathon on the African continent. Even before anybody talked about what is connectathon, we already know that without connectathon, you can test systems, you can deploy systems, you have to test it in the workbench before you take it to the production. And that's what we are driving. And there's a lot of interest. The government is very much interested in hosting their own connectathon now. And this is the kind of catalytic effect we do want to have. And so we believe that going forward, the government and many stakeholders will try to drive activities that will facilitate exchange of information, whichever set of activity in that value chain, whether it's to drive implementation of standard, because we've deployed we've approved standards in Nigeria, but the question I keep asking is how many vendors have even seen these standards? How many of them are using the standards? So again, it's not just about launching the standard, it's about using it. So if everything we do now is driven by how many people are using whatever we are producing, if you are putting out a research paper, how many people are reading it? Again, that becomes the basis for moving forward. So telemedicine, in terms of what is the maturity of telemedicine in Nigeria? And this is a question that I know that Dr. Orogundade and his team will probably answer far better than I can answer. But again, we know we are not getting what we are supposed to get. Telemedicine around the world are often run as an integrated package, but here we are getting video consultation. Again, that's the way I classify it. Others, again, there are exceptions to this. This is not like, those are really exceptions where the systems are integrated. But majority of the telemedicine system that I've seen in the country are actually video consultation. They are not integrated with the EMR system. The registries, of course, we expect that the registries will ensure accountability, who is even providing the consultation. We've even seen cases where people consult from outside the country. And I know MDCN is also working actively. The Medical and Dental Council, sorry, I throw jargons out. The Medical and Dental Council of Nigeria is working actively to come up with a guideline around regulating who actually teleconsult. But we do know it's not only, we do know there are other aspects of telemedicine that we do need to consider that may involve other health professionals. So if the medical doctors are able to nail it, then we could begin to see maybe the nurses, the pharmacists, and the rest come to play. And as a result, if the telemedicine systems are not as integrated, the provider will experience burnout because they then need to be acting as a data entry clerks instead of just providing the service that they are trained for. The patient will be unsatisfied. They probably wait longer, and mistakes may happen in those multiple entry system, and there are so many things that can go wrong there. So in terms of key takeaway, Nigeria is very strong in policy intent. The leadership is clear. Governance, less so. We have health workforce facility registries that have been deployed for many years. They are not being used. We do not, I don't know, that we do not have terminology system, and we are actively interested in those coming up so you can manage what kinds of terminology, which these terminologies, fire server sandboxes, use of these standards are very integral to you running an integrated system. And as a result, we have some of the challenges that we have. But if we are able to move some of this little change, that I call them little because we've done the heavy lifting, it's just this little change that needs to happen, then the vision of integrated telemedicine system that will scale will be very near. And of course, we know capacity still remains a challenge, but that capacity need can be bridged from the university, from the vendors, or even the government themselves. So I will pause here and say thank you very much again for your time listening to me. I'll turn it over to you, Dr. Arogundade.
Thank you very much for that short and precise presentation, Dr. Emeka. We really appreciate the time. And you have actually set the ball rolling. And we're going to be moving to the next phase where we're going to have a panel session. some of the issues you raised, I'm sure our panelists will be dealing with them, and I'm sure our audiences too will like to have some questions. I can see already one or two hands that have been raised, but I'll reserve them for the panel session. And to lead us into that, I'm going to be introducing our moderator, Dr. Raphael Akongbe, who is a digital health expert and also a member of the board of the Society for Telemedicine and eHealth in Nigeria, and has his affiliation with both government and private sector. He will be moderating the session for the panelists that is coming up next. And I hope that as we go along, you'll be able to take down some questions and they will be providing us with answers. Thank you very much. Dr. Raphael, you're welcome online.
Thank you very much, Dr. Arogundade. It's a great pleasure to be on the platform and to be among the experts around the globe. And I want to really appreciate Dr. Emeka for that very insightful presentation that he has just given on to us. But very quickly, we will go into the panel session proper. And we have in the house, some great experts in the house in the area of digital health, telemedicine, and so on and so forth. And we have been able to just pick this expert from different aspects. That is from the federal government, from from private, and also from NGOs. And of course, we have these very important people among us to handle this. And the first person I'll be looking at is an expert, is a digital health expert and a deputy director, Health Services and Environmental Secretariat, FCT in Nigeria. That is in the person of Dr. Iniobong. And I will be, asking you this question, and I believe that the participant around the globe, will be interested to develop their knowledge in this area. Dr. Ini Ekong, I want to believe that you are very much here. So I want to ask you this question before I go into other aspects of our panelists. Dr. Ini Ekong, I want to ask you, Dr. Emeka have really said some very vital things in the presentation, but let me just come to you to ask you this question. What key national policies and regulatory framework are required, to ensure appropriate interoperability and seamless health data exchange across federal, state, and private healthcare system in Nigeria? Over to you, Dr. Ini Ekong. Just 2 minutes.
Thank you very much, Dr. Ralph, and thank you, colleagues. I'm very excited to be contributing at this session. First of all, I think Emeka has talked about several strategic plans and policies that the country has rolled out in the last decade plus. But one critical thing that we need to talk about here is the National Digital Health Enterprise Architecture, which was developed in 2024, which has really specified some of the roadmap that the country wants to take in terms of interoperability. We have that enterprise architecture, but also what is also important is to have a costed roadmap, interoperability roadmap or action plan, which I think is currently being worked on, so as to outline specific activities, timelines, milestones, and responsible parties, and the resources required, to make it operational. So beyond that is what we need also is knowing that interoperability kind of, coalesces multiple systems. So the risk of, privacy and security breach is very high. So we need a lot of data governance, privacy and security guidelines in terms of, legislation, policy, and compliance, frameworks around that, so as to guide different systems that we are going to integrate to adopt a privacy by design, whether during the design phase of these systems or during when they are being implemented. So yes, we have a National Digital Health Enterprise Architecture, which is linked to our National Digital Health Policy and strategic plan, but there is need to, sort of have a more detailed roadmap to help operationalization of the enterprise architecture blueprint, as well as to also safeguard, provide, privacy and security safeguards, towards integrating these systems together. But I think by and large, and also we need a lot of standards, right? I think there are current actions to develop like electoral EMR standards, that will kind of bring the specific activities at the operational level that is required to make all these high-level policies and strategies operational. Thank you. I'm back to you.
Very much. Thank you very much, Dr. Inelbong. In fact, you have really shed a very beautiful light into this. And of course, we know when it comes to interoperability, data is key. You mentioned something very, very important, talking about the data governance. And of course, I believe that, you are working in the federal government, and I know that you are part of those people that are really pushing it hard to ensure that we have, a very good data governance in our country. Now, I want to quickly move to the second panelist, and that is in the person of Mrs. Roslyn Ilori. Mrs. Roslyn Ilori is the Chief Executive Officer, Bridge 57 and Women in Data Privacy. And she is here to share knowledge with us, and I believe that we are going to learn a lot. Now, Mrs. Roslyn Ilori, I want to quickly ask you, Dr. Inelbong, talked a lot about interoperability, which was part of what Dr. Emeka talked about. But now I want to ask you this question. What role can NGO play in training healthcare workers and building digital literacy that is needed to support connected health system in Nigeria? Over to you. You have just 2 minutes, please. Thank you.
All right. Thank you very much, Dr. Akungbe. Good afternoon, everyone. And it's a pleasure and honor to be here. Thank you for having me. So when we look at that, listening to the keynote speaker and all the other people that have shared one or two things during this session, all we are looking at is how do we have digitally empowered healthcare workers, the frontline workers? How do we ensure that, yes, all these, at some point, the telemedicine, eHealth, we are making a lot of progress. Sometimes, someday, we'll continue to make progress and we get there. How do we now ensure that at the end of the day, we have a digitally empowered workforce that can support that system? So there are a couple of ways that NGOs can actually come into play some role. First is, with the positioning of NGOs, the first thing they will need to do that is very important is to connect policy and policy makers with technology providers and then the frontline health workers. So they serve as the central point that actually connect all of these dots. The NGOs, in most cases, are neutral, so they're able to draw and bring all of these different dots together in a way, and connect. Because of time, I'm going to be rushing a bit, so please permit me. Another way that you can look at this is different capacity building programs. How do we, and then Dr. Inelbong said something that is very important when it comes to data privacy. How do we even ensure that the frontline workers, the people that are using this system, they actually understand what is going on, how they have to protect the privacy of the patients, of the data that they have in their custody. So this is another area where the NGO comes in, where they have various capacity building programs that actually ensure that when we look at technology and we look at the ethics, how do we bring those two together to ensure that we are doing telemedicine right? There's something that is very important that Dr. Nyobong mentioned, which is data privacy by design. That is very, very crucial. NGOs need to start funding this and ensuring that when these systems are being built, privacy, trust is built into the system. So that can be specifically funded to ensure that that is built into the system from the word go. So that we don't look at privacy, we don't look at digital trust as an afterthought, but as proactively as part of the system from the beginning. And then lastly, when we look at the rural areas and the underserved areas, the NGO has a whole lot of role to play in educating, in awareness generally for those that are underserved, possibly in local languages, in ways that they can understand this. I hope I've not shot beyond the 2 minutes. Thank you, Dr.
That's great. Thank you so much. Thank you so much. Really, we really appreciate this insight you just put in. And we, we know that NGO has a lot of role to play. Government cannot do it alone. And that is one of the reasons why we have brought you into this platform, because we want to really get the area at which, NGO can actually support the government in the area of, building digital literacy that is needed to connect, health, system in Nigeria. Thank you so much for that insight. Really appreciate it. Now, the next panelist is, one of our own, Dr. Folarin. Dr. Folarin is the Chief Executive Officer and Medical Director, Nigeria Limited. He's also an expert in digital health, and he has made a lot of impact in the digital health field, both within the country and outside this country. And my question goes to you, Dr. Folarin, because you are representing the private sector, and we want you to give us this insight into this question. Now, the question is this: the private sector has largely been the driver of digital health generally in Nigeria. There's no doubt about that. Now, how is the private sector driving the need for a connected health system and interoperability in Nigeria? I know Dr. Emeka and Dr. Iniobong have said something about it, but I know you have a very, another very beautiful insight into this. Over to you, Dr. Folarin.
Thank you very much, Dr. Akabu, for that question. Yes, starting from the keynote speaker and the other speakers, they have touched on this particular topic. And the reality is that the private sector is already building the building blocks for interoperability in Nigeria. Because if you look at it, virtually all the health tech platforms that you find in Nigeria, from telemedicine to EMR to laboratory systems, pharmacy systems, are largely built and deployed by the private sector. The only thing that is missing here is there's no handshake. These things are happening in fragmented manner. And if you think of it, these platforms are already generating a lot of patient data, clinical workflows. But one thing that we have also realized in the private sector is the fact that there needs to be some handshake, and we're already beginning to build systems that are compatible with international standards, using the FHIR standards and then we're building modern systems that are API that you can integrate with API, and building ecosystem. I recall when we started out as a telemedicine platform, then Health Connect 247, now TrueDoc. We came in 2018 and we're like ahead of our time, because when the patient calls in, is through walking through the digital platform, you realize that referral becomes manual. Beyond that telemedicine level, if you have to refer a patient to an in-person or to the next level of care, it becomes a manual thing. So you have to begin to slow down to ensure that whatever you are doing is not ahead of the environment where you currently operate. Like Dr. Emeka mentioned, that some of the digital platforms or telemedicine platform are just video consultation. It's not true for TrueDoc, for instance, because right from the beginning, we have a robust EMR. I mean that, but the EMR in itself is not complete without some interoperability from one system to another. A patient walks into a private hospital today, and he goes to another private hospital tomorrow, he will need to start his medical history all over again. And that's where this interoperability is very important. So the private sector is already doing a lot in this regard, and government doesn't have to discard what has been done. I think what the government needs to do is to find a way to create the structure, the legal backing, the framework, such that when the existing infrastructure that are being built, I mean, like they always say, a regulation is not to stifle innovation, is to even encourage it. And innovation should not be afraid of regulation, because when there's no regulation, trust is eroded. So we have to work hand in hand, because regardless of what we have done at the private level, there needs to be some level of governance structure, policy framework to guide and enforce standards and practices and building of applications for the private healthcare sector. Thank you very much. I hope
Thank you so much. Thank you so much, Dr. Folari. I know right from time that you have always been championing this cause right from time, and you have made a lot of impact, particularly in Lagos State, Nigeria. So it's really a big honor to really have your very insightful, contribution there. Now I will be going to Dr. Ineekong. You are also one of the icons when talking about the digital health, specialists in Nigeria. I think you should be mentioned among this expert in the country. And we all know that when it comes to digital health infrastructure across Nigeria, there are so many disparities that we have. We can see that different kind of solution does not have a proper handshake, just as Dr. Emeka said earlier on, and as a government officer and also a specialist in this area, how can government strategically invest in digital health infrastructure in order to ensure nationwide connectivity? Dr. Ineekong, sorry, over to you. Just 2 minutes, please. Thank you.
Yeah, thank you very much, Dr. Ralph. Yeah, infrastructure provision always starts with readiness assessments, baseline. So there is need to have an e-readiness assessment to identify existing gaps within the infrastructure in terms of computing, connectivity, and most importantly, power infrastructure. And then once that gap is being realized, then there is need to have a costed infrastructure, master plan that allows a phased approach to providing this infrastructure. In terms of, we have quite a number of, like, the country is quite huge, so we have a number of, infrastructure points that we need to expand to. So one of the things that government is doing, and I don't know how many of us have been able to read the National Digital Health Enterprise Architecture Blueprint, which is to kind of prioritize a specific services and application that is linked to the critical health system challenges, in terms of knowing that health is complex with so many areas. So that document has specified working around e-claims management, having some interoperability services like telemedicine, and then logistic and all that. Once that area is prioritized, then the e-readiness assessment comes up in terms of the infrastructure that is required. And then the master plan comes up. And then the next thing now is to look at how do we finance this infrastructure gap. We have to think beyond, and government is actually doing that, or thinking beyond the statutory, budgetary funding to innovative funding around infrastructure provision. Just like we have the Universal Service Provision Fund, which dedicates a specific amount of calls made from amount of cost of telephone calls to a fund that is used to improve access to infrastructure, digital infrastructure nationwide. How can we leverage that into the health sector to help us to expand the digital public infrastructure? These are things that we need to think about. And then how do we involve other innovative, funding mechanisms? For instance, insurance payment mechanism. We know that there is always a capitation payment to health facilities for health insurance. How do we dedicate a specific amount of that payment to infrastructure provision within the health sector? So these are things that, like we say, at the current maturity, we're at the phase 2 maturity of moving from fragmented to interoperability, and we have quite a lot to do. Once that provision the infrastructure is provided, meaningful infrastructure, fit for purpose infrastructure, then it's to think about how do we sustain this infrastructure. So there is need to also have an asset management, system that continuously makes sure that this infrastructure stay functional. So by and large, there's quite a lot of things in the work now, but we still have a long way to go. But I believe with what the enterprise architecture blueprint that we have presently, in a short while, we're going to realize most of this. Thank you very much.
Thank you so much. Thank you so much. That is very awesome. And, we all know, not only in Nigeria, the issue of interoperability and, connecting one system to the other through, digital health, tools is usually, one of the major problems that we're having. And thank you for that insight that you have really given us. I will be coming to you, Mrs. Roslyn Ilori. You are part of the, people that are pushing the NGO in Nigeria. And in your first response, you said something about data privacy. We all know that data is the key when it comes to, operating digital health tools. There is no how digital health tools can actually, be effective without, data. And it is very important that we protect this data the way it should be. So I want to ask you this question. As an NGO, focused person, how can development partners help build, public trust in digital health system, particularly around patient data sharing and privacy? Over to you.
All right, thank you. Let me start by saying that public trust is the foundation of digital health ecosystem. So is it for any other digital system. So it is very important when we are talking about public trust. So whatever system we have, telemedicine and eHealth inclusive, it's very crucial that public trust is built within the ecosystem. So how can we do that? Because if this public trust is not there, we'll struggle with adoption, no matter how beautiful, no matter how brilliant that those solutions, the systems are. If that is lacking, then we will struggle with adoption. So what can development partners do? And there are a couple of things that can be done. And I will start by saying that, I mentioned earlier that NGOs, development partners, they are kind of neutral. So they need to support policymakers, one, in establishment of strong data governance framework. I know some people have already mentioned some of that in the course of this presentation. So not just the establishment, and I know some of them are already in place, but also the enforcement, which is where the work really is. It's very easy to, or rather it's easier to put policies together. but in terms of enforcement. So development partners have to support in that regard so that we can protect the data sharing of patients and to ensure responsible data sharing when it is necessary to be shared, to make sure that it is done responsibly. So the first one is looking at strong data governance by the development partners. Another one is the investment in public awareness and education. That is also very important. I don't know how many seconds I have left, but let me quickly share this. I visited a hospital not too long ago.
Thank you.
Can I still go on? Do I still have 1 minute? Hello? Okay, I guess I can go on. So let me quickly share. Okay. So I was at an hospital where I saw that I could, as a patient, I could see the information of other patients, what they had come to the hospital to do, their names, their phone numbers, their email addresses, and why they had come to the hospital. And I challenged them that this is not how it should be done. But they tried to make some corrections immediately. But we have to ensure that practitioners in healthcare care actually they are responsible for this data. Another thing, if I can share quickly, I mentioned privacy by design earlier, so you can take that, and then we need to support independent oversight and accountability mechanism. And that is also very important. Because of time, I'm sure if I have more time later, I can share more insights on that. Thank you, Dr. Akonwe.
Thank you very much. Thank you so much. Really appreciate. I know if not because of time, you have so many to really, discuss, to share with the participants around the globe. And we really, really appreciate you. I want to quickly move to Dr. Folarin, is representing the private sector. And I will really appreciate you to respond to this question. When we're talking about digitization in Nigeria, I want to ask you, there has been a lot of talk about FHIR, which Dr. Emeka mentioned during his presentation. There has been a lot of talk about FHIR being a panacea for all things interoperability. How true is this? And in Nigeria. Over to you, Dr. Folarin, just for 1.5 minutes.
All right, I'll do my best to work within the time frame you have given me. So thank you very much once again. Very true. FHIR is a very important and powerful tool. It defines how structured health data can be exchanged between systems. But I don't think that FHIR alone cuts it. I don't think that it's a magic on its own, because interoperability goes beyond just FHIR. Interoperability requires a governance framework. There are policies that needs to be defined. There needs to be the willingness of even the providers or institutions to want to share data. There must be standard clinical terminologies and the need for data privacy and data security compliance. These are things that will need to, that FHIR alone cannot address. I think what we can do at the level of Nigeria is to combine FHIR with a strong policy framework, with a trust and integrate the existing telemedicine platform or eHealth platform using the FHIR standards. But in my view, why FHIR is a very strong, powerful technology standard that has been defined, it's not complaining in itself to address interoperability. Thank you very much. Dr. Akonwe, I think I finished too.
Thank you very much. Thank you so much, Dr. Folarin. Thank you so much. Really appreciate. Though we are really running out of time, and there is a need for us to really keep to this time because of so many things that we need to do, and particularly the question and answer session. And even though we have some questions to still ask the panelists, but the time will not really permit us, and we need to quickly look into the Q&A session because of our time. This question is going to be, pushed to anyone, particularly Dr. Iniekong, who is in the policy making, area. So the question is from Icham Chatui. It said, policy and governance question. That is what it titles it. It said, what regulatory or policy frameworks are currently needed in Nigeria in order to ensure that digital health solutions remain secure, interoperable, and ethically managed while scaling nationality? Dr. Iniekong and any other person can actually, answer this. Dr. Iniekong.
Okay, thank you very much. I think a lot has been said around regulation. Basically, we know that we are in the middle of an already existing number of applications, but telemedicine, point of service and applications and all that all over the place. And then it's very critical that, since we are moving into connected health, we really have to streamline all these, applications so that they can connect and speak to each other and help in interoperability. So, we have quite a lot of regulatory requirements, which include standards. Like we said, Nigeria had already adopted some standards, ISO standards in 2019, 32 ISO standards specifically. And then there is also the FIRE standards, which provides the framework to incorporate all these standards and terminologies and profile them against core data elements that is required to exchange between systems. So we also have the NDPA, Nigerian Data Protection authority, that has issued quite a lot of guidelines around privacy and security. But again, the problem is not actually that we're lacking in all these frameworks, but the real problem is how do we operationalize them, which I said before that there's need for operational instruments like a service delivery standards, which the government presently is working on EMR standards. We also need standard operation procedures, terms of reference that are drawn from these, regulatory frameworks. So regulation, awesome. The National Health Act has also talked about the certificate of standards for health technology, but it's not been implemented for over a decade now. So the real focus is on looking at the operational framework that will allow us to implement all these high-level regulatory framework that awesome. We're not lacking in the country. Thank you.
Yeah, Dr. Iniekong, you really hit the nail in the head, and we really appreciate you. We want to really appreciate everyone that have come up here, and I want to invite Dr. Justin to really, come up on board to give, a vote of thanks. I really appreciate everybody from different parts of the world that have joined this webinar. It has really been an eye-opening to every one of us, and indeed, you are highly, appreciated. And Dr. Justin, over to you.
Thank you very much, Dr. Akongbe. Dr. Justin is not here, but right now I'm going to be inviting Klingowski from Poland to tell us about the upcoming webinar for the month of April. Klingowski, please, if you are online, please, let's quickly have that.
Hello.
Yes.
I would like to welcome you on 13th of April, and we are going to give the webinar on telemedicine and eHealth in Poland about the progress, evidence, and future directions. We have some agenda already prepared. We would like to tell you something about about Poland and telemedicine here, and in a European perspective, what is the landscape of digital health, some timeline of telemedicine in Poland, and also show you some cases, what we are doing here, how we implemented the e-prescription, e-referrals, and so on, and show you some future directions, including AI. So welcome on 13th of April.
All right, thank you very much for that. So there you have it on the 13th.
It's Monday. It's Monday, 13th of. Yeah, it's Monday because of the we count on also students' participation, and the Monday is a good day for it.
All right, that's great to know. So
that will be the same
joining...
time, 3 p.m. CET, and as today.
Great. Thank you very much there, Klingowski. We'll be looking forward to joining you in Poland come 4 weeks' time, 13th of April. So thank you, everybody, for being a part of this. It's been a wonderful session for me. It's been eye-opening seeing some of the things happening across the country, Nigeria. And we look forward to having you around again next month when we gather together around Poland and see what is there. Thank you very much, our panelists. I know that we have quite a lot of more questions we want them to answer. We will be welcoming some of them if you choose to. If you still have questions for them that you want to reach us with, you can send your questions to info@SFTeHIN.ng, SFTeHIN.ng, and that's the website of the society in Nigeria. So if you have questions you still want to ask them, send to info@SFTeHIN.ng, and we'll be willing to reach out to you. Thank you once again to our keynote speaker as well. Thank you, Dr. Griffith, Dr. Nihal, Dr. Hassan, and everybody that has joined from around the world. We wish you a wonderful week ahead. Thank you very much and have a pleasant evening. Bye-bye.
Thank you, Nigeria. Thank you for this wonderful webinar.
Thank you.